is Gloria Bille. I work with UNAIDS Regional Office as a Senior Policy, Prevention and Regional Coordination Advisor. I've been working for UNAIDS for the past 17 to 18 years. Pretty much South Africa as a regional focal person has been for the past 3 years. Before that, I've had worked in Zimbabwe, Namibia, Swaziland, Lesotho, Ethiopia, Kenya, and now in South Africa. So kind of have a good perspective of our, specifically this region, very much so. I think the pan prevention approach is good because it starts to thinking of prevention systematically. And we had already, of course, kind of pillars from before the GPC, call it the last mile, the last time that we had working on prevention, we had 5 pillars. They worked when they had to. It was great to understand that because then we have a lot of work within prevention that is clustered. So ideally what happens is, everybody talk about prevention. When you talk about, for instance, I'll give an example for young people. Everybody said we work with young people. But who are the young people you work with? What exactly are you doing with the young people? Key population is one of the groups that was really marginalized. So I think having this, removing the silos and bringing it in one systemic way, that prevention is going to be embedded in what is already happening, in what's happening in the countries and the systems that we have, both at health system and community system, I think it's a great opportunity. Secondly, I feel like the Pan-African prevention movement could actually bring prevention back as a movement, because we had a really good way of managing treatment, but prevention always somehow is always sidelined or underfunded, or it's just one of those, but it is not one of those. And I think it also helps us to really rethink prevention, less of a clinical and more of a development issue, because we have a lot of underlying issues that support or are against prevention, specifically in our region. Look at stigma, looking at working with key populations and gender inequalities and GBV. So prevention is just not fixed up by health clinic or health facility, is beyond. And I think this pan prevention would help us to rethink that differently, because systems from both structural, behavioral, and biomedical, they work together for a reason. They're not separated. So we have to start to think that kind of system, supporting our countries to actually go and do that, being an integrated approach to human person. And it's also a life cycle. Prevention is a life cycle. You need prevention in different ways, different products at different times. I think this is one of the things that could really help us to rethink that differently. I think the potential challenge is going to be still financing for prevention. So 40 years down the lane, government have not really invested in prevention. And I'm saying that because before we talk about the siloed approach, so we always kind of tend to finance prevention in a project mode. So condom this time, it's a new kid on the block, I like to call it. We have Lena, everybody runs there. We have PEP, somebody runs there. But it's a package of services. And as I said before, people need prevention services throughout the life cycle. So I think what in many countries we're going to be doing right now is to have this different kind of mentality. And as you talk about systems thinking on prevention, really incorporating budgets within what works. And I say that all the time, if one sector did well, the others will not suffer. If education was doing its job, I don't think I'll have children, like a lot of young girls in my region, not in school or getting pregnant at school, So it's like, it's not one fits all. And so it's a kind of a holistic, multi-sectoral approach to everybody's wealth and healthcare, for instance, for prevention. So I think we had very good programs before when just HIV was starting. We had an amazing multi-sectoral approach to HIV. Everybody on prevention was working on it. We had different kind of sectors. Education made sure that we even had indicators. I mean, we still have indicators for HIV prevention in each and every sector, but nobody's implementing those. And people are putting funding on it. But somehow, somewhere, when it became this big money in one space or one issue of prevention, forgetting about all the others, you start to see this. I mean, looking at great example is condoms. Condom is one of the cheapest, most effective prevention methodology, and nobody uses it anymore because it's not an in thing anymore. But it is part of exactly what all our governments needs to do right now. So from country to country, for instance, in South Africa, the options are more because the government can actually sustain much more the epidemic. They fund it. They have the capacity to do it. But next door neighbor, Eswatini, has absolutely no capacity to manage to do all this prevention work plus the treatment. So now good countries like Eswatini and Namibia and South Africa, where you buy your own treatment, which is the easiest thing that you've done now, can manage to actually maybe go have much more options for prevention and making that a sustainable way of managing it. But for many of these countries in our region, it's very difficult. It's very difficult for Malawi at 95% of all its HIV work being paid by Global Fund and PEFA. And instead of putting the 16% of people living with HIV in Malawi on treatment, not to go to LEN to try prevention. So I think it's not one fits all. We have different countries that can do this very well, and we have countries that cannot do this very well. So for me personally, I think this system thinking and understanding that prevention is not once off, just like treatment, it's a lifetime, but also not downplay prevention for treatment. I think it's not either or, it's both. They work for us, because even if you're in treatment, you still need prevention. So I think it's how we kind of change the narrative and how prevention is part and parcel of treatment. And the outcomes are better if there's a multi-sectoral approach and everybody actually is everybody's business. And like I think you saw me yesterday saying that prevention is not a cost, it's an investment. Because every time in every place in your life, you will need prevention. Yeah. And condom is 100% not true, because if you want to have children, then you have different kind of ways of managing your prevention needs, right? And your prevention at different level. Age group still, the same way. So I feel like maybe to help us better in this region is maybe to come up with the minimum package we used to do that works for majority of the country but give us the good impact. And those who can actually go extra then can do it. So I think we have a great opportunity. To integrate prevention into the existing system. We have systems that worked. Maybe some of the systems, we don't need them anymore, because then they also bring much more silos into prevention. And just to rethink a little bit, with no funds, what's your opportunity cost for prevention? I think just to rethink this differently for each and every country, I think would be a great idea. But I think it's a great opportunity, specifically because now we're thinking about systems thinking for prevention. Yeah. I think the SNN has done some really amazing tools, specifically for prevention, for leadership, for advocacy, for learning, because sometimes we're so bogged down in your own little space, you don't understand who else does what. So I think this has been done. The South learning has been amazing, both in also country capacity, from moving people from one country to learn from the other. For instance, the PSATs, the prevention settlement tools that we have, that country can actually manage to understand what their prevention programs are and what they can do in their country and how they can get funding from that. I think it's been great opportunities like that. We've had scorecards for prevention that have worked very well in countries just to gauge each other. It's also almost like a good competition between countries, like, how are you here for condom? I'm not anywhere. So I think it's created a really, really good advocacy, and people are like motivated to actually do this. But I think, and also, somehow we managed to bring back prevention data to rethink it differently. But I think what maybe a way forward in this space, and I say that in my region office as UNAIDS, what I'm pushing in the region is just to revitalize, to have a prevention momentum or even a campaign in the region, because our packages have changed so much. We've stopped talking about prevention as a system and prevention as a combination prevention. We started talking about, like, we go back to silo approaches to support prevention. I don't think there's never one bullet that's going to kill everything. It's not a one bullet issue. I think it's beyond that. It's also finding our finances where almost at risk, in a sense that not most at risk because of population, but most at risk at countries, of where we're supposed to be taking the funds that we have right now. How do we optimize them to give us the results they should have been giving us without any more thinking that we're going to get more? So it's basically doing more with less and rethinking that a little bit better. And so because we've had these really good tools, South-South learning, and we know this now, I think is to now capitalize on what we've learned. So I think the next generation of what should be done by SNN is much more country implementation, but also finding, like, the prevention assessment really supported us to understand, look, you don't have a policy that works for you, but the so what? I think this time we should do the so what, because we're thinking systems. So how do we then push the so what in countries, and we can have that much more? And then looking at the funding that has been lost with PEPFAR, so that means we're not going to be IBBS anymore. DHIS are gone. If, like, all the behavioral and structural work that helps us manage prevention, nobody's going to be managing that anymore. So then how do we rethink and have much more simpler, maybe, methodologies or simpler ways of reporting and measure what we're doing, so we can continue to keep the fund? And I feel like because maybe HIV, we're not thinking so much sustainability agenda. We've done this, we've talked about this for 20 years, sustainability of the response. We've even had exits. And the US told us many years ago this, they're exiting. What's your exit strategy? How we're transitioning from these counties to one county, from rich region to rich region. We were hearing it, but maybe we were not listening to how we should do it. So I feel like it's been a great opportunity to do that now, especially going forward with less resources, but much more having robust programs that have been invested in for the longest time, for so long. I don't think this is the time to say that we're going to leave it now. I think it's time to relook our packages and to look at those countries where we can measure prevention better. I mean, Global Fund only gives 9% of the Global Fund in every country proposals. Globally, 9% goes to prevention. We can do more than that. Last year, we had Angola, one of the best countries that had supported, from 9% to 23%. So it's a possibility. So it's just to relook at, and these are the kind of the tools that help us to actually reframe Angola's prevention work. So it's the PSATs, it's the scorecards, it's the South-South learning, it's understanding who else is doing what, having like a consolidated support with TAs, and that helped our country, can help your country. I think that worked very, very well with the TSM. So yeah, moving forward, maybe it's just, I like the systematic way of thinking it. So I think HIV prevention should be systems thinking and not just a siloed approach. Yeah.